Hi everyone, my name is Julia Kooser and I'm a third year medical student at Geisinger Commonwealth School of Medicine. Welcome to another episode of the AIAMC Medical Student Podcast. As a part of this podcast, we aim to highlight medical students and the adversities they have overcome and how those adversities are informing how they plan on practicing medicine in the future. I'm excited today to welcome OSM1 Toscana Ogihara from Des Moines University. Toscana, how are you doing today?
I'm good. I actually have one of my cats on my lap currently, so I don't think I can think of a better start to the day.
Me neither, me neither. My cat is kind of far away in the distance, sleeping on one of 10 million blankets I got for him. But yes, a cat on a lap is a very good start to the day. Um, so wanted to start out pretty broad. I know you probably had to answer this 10,000 times to apply to medical school. If you could reach into the deep, dark recesses of your brain, what would you say has motivated you to pursue medicine originally?
Sure. Well, just for a little background, I'm originally from Los Angeles, California. So I am a West Coast native through and through. I grew up dancing ballet pre-professionally, actually. So that was kind of my life for basically the first 18 years that I can remember. It was school, dance studio, back home for sleep, and school again. What really inspired me, though, was an experience I had my senior year of high school. I was able to connect with a physician locally who works in Venice Beach, and he had heard through the grapevine, through actually the dance studio, that I was interested potentially in pursuing healthcare or going into medicine in some capacity because I was always interested in science. And he offered to have me shadow around his clinic over the summer. And so I took him up on that. And he works at Venice Family Clinic, which is a nonprofit organization. It's actually now under UCLA, but they originally started in the Venice Beach area and have since expanded, and they have multiple locations. And their original location in Venice Beach primarily serves the homeless community there. And I was shadowing and, not doing much as a 17-year-old, but what really inspired me was he would also go out on these rounds to various encampments and homeless shelters and would provide care kind of for those who couldn't make it to the clinic. And it was just, like one big van, him, maybe one other provider, and me, and just make do with what we got. And the individuals there were always so grateful for him. They knew him by name. They said, Dr. King, how are you? Nice to see you again. How's your family? And the way that he practiced was incredibly holistic. I know that's a buzzword nowadays, but he would not only, address the needs that people are coming in with currently, whether it's, oh, I have a foot ulcer, I have this cold, what have you, but he would check in. Hey, how is, getting Section 8 housing? Have you looked into employment here? Hey, I know you've been struggling with, certain like substance use. Have you been interested in counseling or maybe coming off of that? And he would just take into account what factors influenced an individual's life outside of their physical well-being, because ultimately all of those things are impacting one another. He's a DO. And so that's what got me interested primarily in osteopathic medicine. So 17 years, 17-year-old me was just absolutely fell in love with what he did, and I couldn't think of anything that I wanted to do for the rest of my life. So I would love to follow in his footsteps. And 7 years later, we're getting there.
That's awesome. That's awesome. The fact that he worked, with unhoused populations and really focused on health holistically, how do you think that informed how you want to approach medicine?
I would say, so I actually have experiences as a patient as well. Um, I was diagnosed in 2019 with a chronic health condition that has really impacted how I view healthcare and how I receive healthcare. And I've noticed from my own experiences as a patient when providers are only looking at what's given or what's presenting in front of them, as opposed to really diving in deeper to, be curious and always be open-minded and see what they can do outside of maybe what they initially think to do. And the providers who are always connecting the dots, who are thinking back to other conversations, who are mentioning things that I didn't even think were important at the time and saying, hey, I remember you saying this. Maybe let's address this or let's talk about this. Those were always the providers that really went above and beyond for me. And so if I can be that type of provider for even just a handful of patients, I know that I can really significantly change lives in ways that I don't think we'll know, until way further into the future. And that's kind of my philosophy in healthcare and the type of medicine that I want to practice.
Mhm. Yeah, that's, I feel like really fantastic. And I think the way everyone should practice healthcare. I'm really interested in psychiatry. I'm a third year student, so we're thinking about residencies now. And psych, I originally wasn't on my radar, but I just feel like the more exposure I had to psychiatry, um, I really appreciated how it was so interdisciplinary and holistic, like you said. You're doing rounding with social workers, nurses. Um, there's a whole team, and a lot of patients, for example, were admitted to the hospital in relation to major depressive disorder, in relation to um, a chronic health condition. And, I just felt for me personally, psychiatry was a way to address everything holistically. And, I don't think it just has to be psychiatry. I think everyone has one particular thing that they feel like addresses all other facets of health. Um, and, I do think that's great that you've met people who've practiced holistically because, I think addressing all aspects of health is how you address one aspect of health.
Definitely. And I appreciate you bringing up the collaborative nature of healthcare as well, working with social workers, working with nurses, dietitians, occupational therapists. I mean, the list goes above and beyond, but we're relying on all of our peers and our coworkers. And if we can work collaboratively and think about all these various facets, then we're much more of a well-oiled machine than, just one individual.
Mhm. And again, please feel free to elaborate as much or as little as you want to. I know it is a personal thing, but if you could tell me a little bit more about 2019, when you were diagnosed with the chronic health condition, like what were your feelings around that? Like if you just wanted to elaborate, but again, feel free as much or as little as you would feel comfortable with.
Definitely. In the last few years, I've definitely been, um, my goal is to kind of model the type of vulnerability and openness that I so appreciate in others. And so if I get the chance to be able to speak about my conditions that, may not be the most, how, I don't know, like, I guess not the best things, but the things that make me human, um, that's kind of my goal. And so, actually, when you were mentioning, like adversity and how med students get to where they are, I thought, oh, this is the perfect opportunity because, maybe I can be that person that pre-med me would have absolutely loved. But so in 2019, it had gotten to the point where I was having really hard time just getting out of bed. I was incredibly fatigued all the time. I was struggling with chronic pain that I didn't even realize was, categorized as chronic pain. Growing up as a dancer, I thought, oh, everyone wakes up with some aches and pains in their joints. And when I brought that up to my primary care provider at the time, she said, well, I mean, does it stay throughout the day or is it just the mornings? I said, no, it's like a constant, ache, pain, bones are popping and cracking. And she said, oh, that's not normal. And I said, Oh, really? I was shocked actually. That was when I was about 16 years old. So I had had this, 4 or 5 year period where I was really struggling physically, and my body was starting to kind of deteriorate in a way that I was not at all anticipating or ready for because I was performing at such a, high level as an athlete, as a dancer. And so my physical therapist actually was the one who connected the dots. I had been seeing her for years at this point, and she said, the fact that you've dislocated your shoulder 5 times in the span of 3, 4 years is not normal. You might be flexible like a lot of your dancer peers, but they don't struggle with these types of dislocations. And so she said, have you ever been tested for the Ehlers-Danlos syndrome family? And I had no idea what she was talking about. I immediately went home and went down this like Google rabbit hole because I was 18, 19 years old and I was interested. I knew I wanted to go into healthcare. So I thought, okay, I'm going to do my homework and I'm going to know what I'm talking about. And I had read the diagnostic criteria for the hypermobile subtype and I thought, oh my goodness, this fits me to a T. So I brought it up to my primary care provider at the time. She went over the criteria and I checked all the boxes. I would say that I, made full marks on a test that maybe not you wouldn't want to make full marks on. So I was officially then diagnosed with hypermobile Ehlers-Danlos syndrome. And I do believe that in the last 2, 3 years, hypermobility and HEDS has been kind of a hot topic. A lot of people on social media I see, especially on TikTok, love talking about it. And so there was a time where I was actually kind of embarrassed or definitely wary talking about my condition because I never wanted to be perceived as someone who was, you know, faking it, I guess, for lack of a better word. And for so long, I was my chronic pain and my joint issues were kind of brushed to the side, saying, oh, well, you're just hypermobile because you're a dancer, that I didn't want to experience that all over again. So I kind of kept it to myself. But like I said, in the last few years, I definitely want to model that openness and vulnerability that I appreciate in others. And so I try to be more vocal about it and advocate for chronic pain patients and people struggling with invisible physical disabilities.
Yeah, yeah, no, that's amazing. Thank you so much for sharing. Um, it kind of reminds me, and this is in its own way very, very different. But I ran cross country and track and field in high school, and was really into it, was really going to pursue a long-term career with it. But I just got to a point where like I could barely move. And then I thought, oh my goodness, like if I can't walk, how am I going to run? And then, this kind of happened recurringly. And I ultimately, went to the doctor. And at first, x-rays didn't really show anything. So I just kind of thought, like, I can't walk, but the x-rays are clear. And then I ultimately got an MRI. And it turned out at that point that, after collecting more history, the doctor assumed that I must have had like 4 or 5 stress fractures. And it was kind of validating. And then I got a DEXA scan and had like pretty low bone density. And apparently, that's actually really common with runners, especially like teenage age. And I can remember, I think it's validating. It can be tough like finding out what's wrong, but also at the same time it's kind of there's validation in knowing like there's a cause to this, so I
Definitely.
don't know, did you feel validated,
Absolutely. I remember very distinctly, I was 13 years old and I was having wrist pain. This is kind of the first manifestation, at least that I can remember, of, my mother and I joked about it at the time. We said, oh, Toscana's medical mysteries. There was always something that the doctors couldn't quite, explain or put their finger on. And so the first instance of that was I was having this wrist pain and they did various, x-rays, scans, and they said, oh, you might have a very slight stress fracture. Did you fall? Did you do anything? I said no. They kept pushing on me and saying, "Are you sure you didn't fall and you just don't remember or you don't want to talk about it?" I said, "I promise you I didn't." And they put me in a cast, and from that point on, I mean, it was like things started piling up. I was having the back pain, I was having joint pain. And so I honestly thought I was just either going crazy or that I was being a wimp because I thought, oh, well, if all of my dance peers can get through multiple hours a day, every Saturday we would basically be in the studio from 8 to 5 or even longer and for rehearsals and whatnot. And if they can handle it, then why can't I? Am I being too sensitive? So when I finally got that diagnosis, yes, it was frustrating because my perception of myself and how I perceived my own body and my capabilities drastically changed. But on the flip side, it was incredibly validating. I thought, oh, all these years I was having all these issues, and it wasn't just me, being dramatic or, wanting the attention because no 16-year-old wants that type of attention for sure. At least I could speak for myself, I didn't. And so it was finally that answer that I don't think I even realized at the time that I'd been looking for so long.
Yeah. Well, yeah. Yeah, I can relate to that feeling. Well, it was fantastic hearing from you. Thank you so much for sharing your story. And I really love that you said you want to model that vulnerability that if a patient's going to be vulnerable with you, I think, like you said, it's important to model that vulnerability so that other people can display it with you. Well, thank you so much. This is Toscana Ogihara, first year OMS1 at Des Moines University. Thank you so much for sharing your story, and it was great talking to you today.
Thank you so much for having me.
Yeah, no problem.